Cultural. In this video, we are going to learn more about the cultural formation in psychiatric assessment, health disparity, bias, and accuracy diagnosis, immigrant and refugee mental health, indigenous and minority mental health, social determinant of a mental health, cultural response psychotherapy, equality focus psychiatric practice, cultural psychiatry and diversity, and social determinant of mental health. Psychiatric practice happen within the culture, society, and historical contexts. Mental health symptoms help seeking behavior, explain illness, treatment preference, respond to psychiatric interventions, are influenced by culture, family system, religious and spiritual, language and identity, community value, social conditions, and access to care, and experience of a discrimination and trauma. Cultural psychiatry examine how the culture factors influence the express of a psychiatric symptoms. Diagnose, interpretation, treatment engagement, and recovery. For psychiatric, cultural competency. For psychiatrists, cultural competency is not simply learn about the different groups. It requires developing the ability to understand each patient's individual world, to recognize personal and systemic bias, to avoid diagnosis assumptions, and to adapt treatment to the patient's value and circumstances. This goal is not to identify the care for each patient. The goal is to provide equitable, individualized, evidence-based psychiatric care. We are going to explain the role of the culture in psychiatric. Form culturally informed psychiatric evaluation. Apply cultural formation interview. Recognize the impact of a social determinant of health. Provide trauma-informed cultural response care. Understand disparity in psychiatric diagnosis and treatment. We're going to address the barrier affecting treatment engagement, integrate patient value into the psychiatric treatment plan. Fundamental of a psychiatric cultural psychiatric is defined as the study that cultural psychiatric is defined that fundamental of a cultural psychiatric is the field that study the relationship between culture, human behavior, mental illness, psychiatric treatment, because culture is influence how the symptoms are expressed, how the stress is communicated, whether the treatment is sought, how the illness is understood. Cultural and psychiatric diagnosis. Culture affects the psychiatric diagnosis in several ways. It affects symptom expression. Patient may describe stress, thoughts, emotional symptoms, for example, sadness, fear, or irritability. Physical symptoms, fatigue, pain, headache, GI symptoms. Some cultures emphasize physical expression of emotional distress. Illness explain morals. Patients may understand symptoms through biological explanation, psychological explanation, spiritual explanation, family or community formulation framework. Clinicians should explore these beliefs rather than missing them. Cultural humility. Cultural humility is the lifelong process involving self-reflection, recognition of a limitations, personal limitations, provider limitations, openness to learn from the patient, awareness of power differences, cultural competency versus cultural humility. Cultural competency, knowledge about the culture. It's the knowledge about the culture. Focus on skills and can imply experience and may generally cultural information, may use general cultural information. However, cultural humility is a continual learning. Focus on a relationship between clinicians and the patient. Recognize the limitation, person limitation, provider limitation. Emphasize individual experience. Cultural assessment in psychiatric practice. Culturally informed psychiatric assessment explores identity, meaning of the symptoms, family contacts, beliefs about the illness. You want to know what the patient belief is from their illness. You will ask them, what do you believe caused your illness? So you can know what the belief is. What belief is about the illness, how they believe about the illness. Treatment expectations. The key assessment question is for cultural identity. You will ask, how do you describe your cultural background? How do you describe your cultural background? Are there cultural or community groups that are important to you? Meaning of symptoms. You will ask the patient, what do you think is causing these experiences? What does your family or community believe is happening? Preferences. You will ask the patient what type of treatment feel acceptable to you. What are the practice beliefs we should consider? Cultural formation interview. Cultural formation interview from the diagnosis DSM-5 treatment criteria helps the clinician understand the patient cultural context. For what are the major domains? Cultural definition of a problem. You want to explore patient understanding of the symptoms. Description of the suffering. Cultural perception of the cause. You want to explore explanation of the illness. Beliefs about why the symptoms develop. Cultural stressor and support. You want to explore family, community, social pressure. You want to ask the resources, and you want to know the resources of that group. Cultural features of the clinician-patient relationship. You want to explore community expectations, trust, power differences, social determinant of mental health. Social determinant of mental health are conditions in which are both which are born, grown, social determinant of health. His definition of a social determinant of health are conditions in which people are born into, grown, learn, work, live, and age. These conditions influence healthy outcomes. Major social determinants include economy, disability, economic ability, education, healthy access, neighborhood environment, social support, safety, transportation, and food security. Poverty and mental health. Economic hardship is associated with increased risk of depression, anxiety, trauma-related disorders, substance usage disorders. Clinical considerations. Assess housing ability. You want to assess housing ability, food access, employment, financial stress, transportation barriers, housing and mental health. Housing instability increases the risk of a psychiatric relapse, medication non-compliant, crisis, usage, hospitalization. Interventions that you want to consider include case management, community resources, housing programs, social work collaboration, education and mental health. Education influences health literacy, employment opportunity, access to resources, clinical approach. The clinical approach that you want to make is to avoid assumption about intellectual basis, like education level, language ability, community styles, healthcare access, and psychiatric disparities are the barriers. Those barriers include cost of seeking psychiatric access, mental health access. It includes barriers to transportation, provider availability. Sometimes providers are not available for areas, for towns, for neighborhoods. Stigma is one of those barriers. Language barriers, lack of insurance coverage. So healthcare access and psychiatric disparity are the barriers such as cost, transportation, provider inavailability, stigma, language barriers, lack of insurance coverage. Consequence of these barriers may include delayed diagnosis, reduced treatment management, higher crisis usage, language barriers, and psychiatric care. How language influences psychiatric care. Language differences can affect language difference between the provider and the patient, can affect the symptoms report. Diagnosis, informed consent, treatment planning, best practice. For best practice, you want to use qualified medical interpretations or translator, clear communication, teach-back method to know the patient understands what you're telling them. You want to avoid using the family members as a translator for complex psychiatric discussions when professional translators are available. Racial, ethical, and mental health. Racial and ethnic are important social and cultural factors that influence healthcare experience. Factors affecting the mental health include historical trauma, discrimination, health inequality, community report, bias in psychiatric assessment. Clinicians must recognize the potential bias. The type of bias include explicit bias, which is the automatic assumption of that may influence perception and decision making. So implicit bias is an automatic assumption that can influence perception and decision making. Diagnostic bias. Examples include overdiagnosis certain disorders, recognition symptoms in certain populations. Communication bias differences in eye contact. People are different when they do eye contact. It depends on the culture how you do the eye contact. Emotional expression is different from culture to culture. Communication style is different from culture to culture. Trauma, operation, and mental health. Explore a chronic stress and adversity. Exposure to chronic stress and adversity can influence neurological stress response, emotional regulation. Example of a psychosocial stressor include discrimination, violent exposure, forced migration, poverty, loss of community. Immigration and refugee mental health. Immigration may involve loss of community, loss of culture, loss of language, separation, cultural adjustment, legal uncertainty. Trauma exposure. Common psychiatric conditions include PTSD. PTSD is higher for immigrants and refugees. Depression is higher. Anxiety disorder is higher. Adjustment disorder is higher. Assessment considerations for immigrants and refugees. You want to explore immigration history for this patient's family, this patient and the family. You want to explore trauma exposure. You want to explore family separation. You want to explore current supports. Do the patient has support, family support, community supports? Cultural adaptation. Are they going to adapt? Do they adapt it to the system, culture, where they are? Indigenous mental health considerations. Many indigenous communities experience historical trauma, cultural disruption, healthcare disparity. Cultural responsive care. Cultural responsive care may include community-based approach, respect for traditional healing practices. You want to collaborate with cultural healers when appropriate. Religion and spiritual in psychiatric. Religion and spiritual psychiatric influence meaning making, coping skills, and treatment decision making. Assessment questions include what is your spiritual beliefs that important in your life? How do these beliefs influence your understanding of your illness? Clinical principles, spiritual belief should be respected, explored, differential from psychopathology. We want to talk about family and community systems. Many community emphasize family involvement, collective decision making, interdependency. As a provider, you want to consider clinical considerations is you want to assess who makes the healthcare decisions, who provides support, what role does the family play? Stigma and mental health. Stigma may prevent individuals from seeking help. It includes public stigma, self-stigma, structural stigma. So public stigma is a negative social attitude toward that illness, toward that mental illness. Self-stigma is internal negative belief of that disease. Structural stigma is system level barrier. Interventions include educate the patient, normalize the stigma, recognize recovery-oriented language. You want to use the recovery-oriented language. You want to advocate for the patient. Culturally responsive psychotherapy. What are the culturally responsive psychotherapy? Effective psychotherapy requires adaptation to the value, family value, patient value, system values, adaptation to the community style, family context, and patient goals. Important principles include collaboration, respect, and flexibility. You want to collaborate treatment decisions, and you want to make it shared decision between the provider and the patient. You want to respect the patient beliefs and acknowledge their background. You want to be flexible. Interventions are adapted when appropriate. Cultural consideration in psychopharmacology. Culture may influence medication acceptance, expectations, concerns about the adversary or side effects. So, assessment questions include explore previous medication experience, family belief about the medication, concern about the dependency or the stigma. Healthy, equality, and efficacy. provider contribute to health equality by recognizing the barriers that the patient is going through, improving the access to health care, supporting vulnerable population and the patient and the community, advocating for the patient and the community, clinical case study. I have a clinical case study for you. You have a 35 years old patient who presented depression mood, insomnia, and social withdrawal. The patient explains, my family believes this is a spiritual issue, not medical. You want to assessment. Important area that you want to assess is the patient own belief. You want to ask them, what do you believe? What do you believe? What do you believe about? What do you believe cause your problem? What you believe is causing your symptoms? You want to assess the family influence on the treatment and on the patient. Cultural meanings, you want to also assess the cultural meanings of these symptoms. You want to also explore and assess the treatment preference for the patient and the family. Clinical formation, possible major depression. Possible this is a major depression disorder. However, assessment must include, even though you believe this is the major depression disorder, you have to assess the cultural explanation of the symptoms, family contacts of the symptoms, and support the symptoms that the patient have to get better. Treatment planning. Treatment planning include education about the depression, respect for discussion of the belief, collaboration treatment plan, consideration of family involvement if they desire, evidence-based psychiatric treatment. In conclusion, cultural influences how symptoms are expressed, but never assume every person of a culture thinks or believes the same way. Ask the patient what their symptoms mean to them before explaining what they mean clinically. Social conditions are psychiatric risk factors and must be assessed. Language, access in a patient safety issue. Language access is a patient safety issue. Cultural humility is more important than memorizing the fact about culture. The best psychiatric treatment plan is the one that is a scientific sound and personal, meaningful to the patient. So, what is the purpose of a cultural interview? The cultural interview is to understand how the cultural identity, beliefs, stress, and support influences psychiatric symptoms and treatment. What are the social determinants of mental health? Social and environmental conditions that influence health outcomes include housing, education, income, health seeking, and social support. Why should clinicians use professional translators? Because they want to improve the accuracy and confidentiality and informed consent and patient safety. They want to use the professional translator because they want to improve the accuracy of their treatment plan assessment. They want to have a confidentiality. They want to provide informed consent. They want to provide education for the benefit and risk of the treatment and have informed consent. So they have to have a professional translator that can explain clearly to the patient about the treatment, about the risks, about the benefit. And also they want to improve the patient safety. What is the cultural humility? Cultural humility is a lifelong process of self-reflection, learning and recognizing that patients experience regarding their own culture, patient expectations regarding their own cultures. Why is understanding social determinants is important in psychiatric practice? Because social conditions significantly influences psychiatric risks, treatment accessibility, treatment compliance, and treatment outcome and recovery. Cultural, psychiatric, and social determinants of health are fundamental components of advanced psychiatric practice. Mental health cannot be separated from the environment, identity, relationship, and experience of the patient. Clinicians must integrate cultural assessment, social history, trauma-informed care, Health equality principles, share decision making between the patient and the provider, an individual treatment plan. The central principles of a cultural response psychiatric care is understanding the patient within their world before attempting to understand their illness. Thank you for joining me today. I would love to see you in my next video. Please subscribe and join me again. Thank you.